Hello, this is Macy Haight, a second-year medical student at OSU's College of Osteopathic Medicine at the Cherokee Nation. I will be presenting our poster, Quantifying Public Interest in Merkel Cell Carcinoma in the United States following the death of Jimmy Buffett and implications for continued health advocacy. This is a work of myself and my colleagues, Hayden Jacobs, Sarah Bolte, Dr. Kelly Murray, and Dr. Micah Hartwell. The Health Information National Trends Survey showed that among those seeking information on cancer in 2008, 55% consulted the internet first, whereas 23% first consulted their physicians. Mass media coverage of celebrity diagnosis is proven to significantly impact public search activity in common cancers. Recently, on September 1st, 2023, singer-songwriter Jimmy Buffett died at the age of 76 after a battle with lymphoma precipitating from Merkel cell carcinoma. Merkel cell carcinoma is a non-melanoma skin cancer possessing a high metastatic potential of about 30% of cases having metastasized at the time of diagnosis. Our objectives were to quantify public search interest in skin cancer, especially Merkel cell carcinoma, and relative risk factors before and after Buffett's death. Secondly, we wanted to quantify the duration of sustained interest in these search terms following Buffett's death. In order to do this, daily search interest data was obtained from Google Trends related to topics of skin cancer, Merkel cell carcinoma, and health effects of sunlight exposure within the United States from August 2nd to September 30th, 2023. Search interest from Google Trends is reported as relative search interest, or RSI, on a 0 to 100 scale, where 100 is the peak interest within the search timeframe. Autoregressive integrated moving logarithm was constructed for each of the topics as if Buffett's death had not occurred. By doing this, we were able to compare forecasted and actual values to determine the increase in RSI for each topic following Buffett's death. These are our results. So the first table is search interest in skin cancer, Merkel cell carcinoma, and health effects of sunlight exposure. RSI for skin cancer and Merkel cell carcinoma each peaked on September 3rd, 2023, and health effects of sunlight exposure peaked on September 4th, 2023, 3 days following Buffett's death, and then 1 to 2 days following Buffett's death, reported on major news outlets. The forecasted values compared to actual RSI values represent statistically significant increases in Google search terms for skin cancer, Merkel cell carcinoma, and health effects of sunlight exposure, as we can see in the table below. After Jimmy Buffett's death, public search interest in Google search terms skin cancer, Merkel cell carcinoma, and health effects of sunlight exposure significantly increased. The Skin Cancer Foundation recognizes the increased interest in Merkel cell carcinoma following Buffett's death, noting that its website experienced increased traffic to its pages containing Merkel cell carcinoma information. However, widespread advocacy for Merkel cell carcinoma prevention, diagnosis, and treatment prior to or following Buffett's death is lacking. All in all, Merkel cell carcinoma research and therapeutic development is a vast field of opportunity. With sustained public interest, advances in Merkel cell carcinoma screening and treatment aimed at mitigating unmet medical needs might be expedited. Though Merkel cell carcinoma is highly aggressive, it is very treatable if caught early on, according to the Skin Care Foundation. Merkel cell carcinoma research and therapeutic development is a wide field of opportunity, with the International Workshop on Merkel cell carcinoma research identifying Merkel cell carcinoma clinical knowledge gaps, establishing research priorities, and calling for a collaborative multi-institutional effort to improve the clinical management of Merkel cell carcinoma. Other researchers have highlighted unmet medical needs in individuals with advanced or recurrent Merkel cell carcinoma, especially those who were unresponsive to current first-line treatments. In order to leverage this increased interest in Merkel cell carcinoma effectively, it is essential to maintain sustainable infrastructure for continued Merkel cell carcinoma awareness, screening, treatment, and further research. These are the references that were used for our poster presentation. And here's our author's information. This is myself, Macy Haight. I will be serving as the corresponding author. The best way to contact me is by email or phone, as listed there. And then we would like to give a special thanks to Dr. Micah Hartwell and Dr. Kelly Murray for their input and guidance throughout this project. Thank you.